So, ladies and gentlemen, my name is Sharon Whiteman, and I work with the team at the Lyme Disease Association of Australia. And we're really excited this year for May Lyme to be able to be providing pathways that you can take with your own hands and start to work with yourself because the situation in Australia is pretty dire. So we'll talk more about that, but we're very privileged today to have Dr. Nicola Ducharme. She's always a yes to help Australia, and we're really grateful and blessed to have so. So I know some of you won't have had the opportunity to know about Dr. Nicola. Dr. Nicola Ducharme is a licensed naturopathic doctor, founder, and medical director of Restore Medicine in San Diego. She's an internationally recognized Lyme disease expert, and her background includes training in Australia and the United States, working in integrative medicine and an authorship of several books. She describes herself as an Aussie girl at heart and says that she's first worked in fitness before moving to nutrition and naturopathic medicine. She later studied at Bastyr University, completing research and clinical training in Seattle, and moved to San Diego in 2003 to start Restore Medicine. So as a medical advisor to Lyme Disease Association of Australia, she's passionate about helping with people with chronic complex illnesses through a blend of physical, emotional, mental, and spiritual support. And like we said, she does have a soft spot for us down here in Oz and knows how tough it is for patients trying to get treatment right now. So welcome, Dr. Nicola. And as always, thank you so very much.
No, you're so welcome. It's great to see you and great to be here.
Oh, awesome. So um, I know that you're originally Australian and working, but now you're working internationally with Lyme patients. I'm a bit jealous that you live in San Diego, but there's some nice Aussie
It's pretty
places.
nice, I won't lie.
So from the beginning, what started you? What led you down the path of Lyme and associated infections?
Yeah, I mean, good question. So when I got out of school, I was very fortunate to go into a practice for the first couple of years with a doctor who was treating kids on the spectrum, autism spectrum. And so I went into his practice and he really trained me up on that work. And that's what I did for my first couple of years. But what I found then is I started seeing some of the mums of these kids I was working with. And they'd come see me, and because I was like the female hormone person too, and they'd come in and they'd be like, I'm exhausted and everything hurts and I can't think, and the list goes on. And they all said the same thing. Like at first I thought it was just new mom stuff, and then I thought it was like, special needs kids, that's just a lot, and then after a while, they were like, this just is not right. And so I started doing sort of like a functional medicine workup on them, testing for all kinds of things from, heavy metal toxicity, adrenal fatigue, et cetera, et cetera. And Lyme was on my list. And I was kind of shocked at how frequently I saw it coming back positive. And I remember at that time, and this was in Southern California. So I'm not saying that all those people contracted Lyme in Southern California, but they're living in Southern California. And so anyway, that sort of started the journey, and it just sort of naturally progressed from there. And then, I've really, really felt very blessed to be able to work with some of the Aussies. And like you said, there definitely is a soft spot in my heart. I spent over 20 years growing up in Australia. So it's been amazing to be able to connect with some of the patients over there too.
I can identify that I'm Canadian born. So I was there 30 years. I've been here over 30 years now. So it's sort of a competition of who I love most. But
Well, I'm the same. I've lived in the US for longer than I lived in Australia.
yeah.
And I was born in England, so I carry 3 passports.
Uh-huh.
Keep them all current, just,
Just in
options,
case. Yeah.
just in case. But yeah, no, it's lovely to be able to sort of have those roots and be able to visit back.
So for people new, I'd say most people listening will have understood some level, but in case there's someone here who doesn't really know about the integrative approach, explain what that is and why. Well, I think it's the only, I'm a retired ICU nurse. I
Mhm.
started to see gaps in healthcare, Western healthcare, after about 10 years of being in nursing, started exploring an
Yeah,
integrative approach then, long before I got bit. And so
yeah.
how was that for you?
Well, I definitely came into naturopathic medicine from the naturopathic side. Some people
Mm,
come into it more from the medical background and then kind of transfer over. I definitely came at it, I was a traditional naturopath in Australia. And naturopathic medicine, as we know it in the US, doesn't exist in Australia. So,
mm, mm,
um, so I trained as a traditional naturopath there. So, the integrative approach to me is it sort of operates on a couple of different levels. I'd say the first thing that comes to my mind is that we get to combine Western medicine with more natural approaches. So, in my practice here, I do a lot of long-term antibiotics. I do a lot of, hormone support. I do a lot of gut health and digestive support. But, I can prescribe in California, naturopathic doctors can prescribe everything but controlled substances. So for me, it's like, okay, so if I have a Lyme patient, we might do a year of long-term antibiotics, multiple antibiotics, which doesn't sound very naturopathic. However, I can then use my naturopathic tools to help support detoxification and keep the gut microbiome healthy and balanced. And so it's really, to me, bringing those two worlds together. And I know in Lyme treatment, there are some people that are like 100% antibiotics only. Some of our top Lyme docs here, Western trained medical doctors, wouldn't even believe in a probiotic for their patients, and then you've got some who are like, antibiotics are the devil, it's just going to make you worse, it's the last thing anyone should do. And that's not true either. I've had many, many patients where antibiotics gave them their life back.
Yeah.
So integrative for me means bringing those two worlds together and kind of utilizing the best of both. But it also means in recognizing other factors. So looking at, hormone balance, looking at gut health, thyroid, nervous system regulation is something that I've been paying more attention to. All of these other factors. So it's not just one system. It's not just one. It's so much more complex than just, it's a bacteria. It's so much more complex than that. So the integrative approach then looks at all of those different factors and addresses as many as possible at any given time.
That's that's where my passion is too. I think, that's where healthcare should be. For people in Australia right now, I think I've mentioned to you, there's actually no clear pathway to a medical appointment in Australia any longer. The doctors that are remaining after, many experiences, their books are full, and most of them have, a year-long waiting list, and they have agreed, thank goodness to them, to open short appointments for new tick bites, because we realize we just can't have people who going down that funnel of chronic illness because they can't access treatment after a tick bite with symptoms. So what would you like to say to patients who, in Australia right now, who I can hand on heart say feel totally abandoned by the system, so to speak, the healthcare system?
Yeah. Well, the first thing I'd say is you have been, and no, I'm sorry,
Yeah.
It's a really, really sad situation, and it's worse now than it was 10 years ago. 10 years ago, there were a few docs out there doing their thing, and I was like co-managing patients with some of them, and we had these great things going on. And so, my encouragement would be to just focus on what you can do, and utilize, whether it's naturopaths who really know, detox and gut health or immune regulation, or, functional medicine doctors who are at least, they may not be, looking at Lyme per se, may not be treating Lyme per se, but at least they're looking at the big picture and looking at how to put all the systems together. So I think, the best that we can do at this point is and I know it's so easy for me to sit here and say this, but to try as much as possible to let go of the anger and the resentment about it, because while it's all justified, it doesn't help you, right? So that's just going to keep you stuck in negative thought cycles and neural pathways. And I remember being at a conference in Sydney, actually. I remember flying in and going straight from the airport to this conference and presenting. And then, there were a couple of very well-known doctors there and a couple from the States. And there was a Q&A after, like a time for a panel with the doctors. And I remember this lady got up and she spent several minutes, like almost 10 minutes, talking about how hard it had been and there's no help and how unfair it is and all of that. And I remember thinking, like, compassionately, I very much cared for her situation, but I remember thinking, you got 4 or 5 experts right here. Like, utilize us for information right now. Like, pick our brains of what you can do. So I really think the emphasis has to be on, looking at the things. And that one thing that I have found in my practice in the last several years that has really kind of taken me a bit by surprise, and it took me a while to really acknowledge it, was the role of mold toxicity and mycotoxin illness and how commingled it is with Lyme. So, looking into those factors, you can get a mycotoxin test now through Naturopath. There are docs that know mold detox. If nothing else, like, go to a really good naturopath who knows how to balance Th1, Th2 immune function, who knows how to address inflammation in the body, who knows something about mold illness. I know that's also a bit of a gray area. So not every doc's going to, acknowledge that either. But detoxing mold is one of the best things you can do for your Lyme. I can tell you that. And so those are the kinds of things where, I think that there are opportunities to, to help oneself, doing the dietary modifications, getting inflammation down in the body however you can, detoxing however you can, get in the infrared sauna, get in the Epsom salts baths. Little things like that could all add up. So, and I recognize that that's not the same as a doctor saying, okay, how are we going to treat your Lyme? Let's go. But these things do make a difference. And, I think the role of nervous system regulation is being more recognized. I'm working with my patients a lot more on that. But there are great programs like Primal Trust and DNRS and the Gupta program, things that can be accessed from your computer at home from any part of the world that I think can really contribute to healing. Oh, Sharon, you're muted.
Sorry, as we had a bit of a laugh, Dr. Nicola and I, at the beginning about what potentially could go wrong. And the dogs next door barked and my dogs went off like doorbells. So apologies. So you've done a really good job there of explaining the whole situation and both sides and what we can do and kind of new ways where we, you fall off the wagon and get negative, and then you pick yourself back up and focus exactly what you just said, what you can do. So one of the things they can do is partner with you with Lyme-Ed. So tell us about the beginning of Lyme-Ed and where it's at now and some of its unique aspects.
Yeah, so I created a program a few years ago now called Lyme-Ed for Patients and Lyme-Ed for Practitioners. And the practitioner one was designed to help empower practitioners who may be new to Lyme, may not even be wanting to delve in and treat it fully, but just want to at least have recognition, know what tests to order, some of the symptoms of the different co-infections, just enough to be able to recognize. But it is also a deep dive for people who really want to learn. So there is a patient version also called Lyme-Ed for Patients, and it's multiple modules. It's about 25 hours of learning and everything from, what tests to order. And, Australians can do testing through IGeneX and US labs, at least just to get clear data. And European labs as well. So there is good testing that's available. Other tests to run, other things to look at, everything from antibiotic protocols, which understanding in the Australian scenario is probably the most challenging to access. But there's a whole module on nutrition and Lyme. There's a whole module on detoxification and Lyme, why it's so important, how to do it. There's a whole module on Lyme and hormones, Lyme and the digestive system. So it really is very in-depth, and obviously a whole module on naturopathic approaches to Lyme and different herbs and what they all do and how to use them. And there is actually protocol information in there as well. Because anytime I do anything educational, whether it's a book or an interview or a course or whatever, I always try and make it really practical and that things that people can apply. And so that's just, that's one of the tools that people have really enjoyed over the years of being able to get a deep dive, really get to understand what's going on here. And then I actually just released another course called Mastering Mold Illness, just because I am treating so much mycotoxin illness now. And there's a masterclass in there on MCAS, which again is coming up more and more. So we know that Lyme and mold are two main big triggers for mast cell activation syndrome. And so I'm kind of working more and more with patients on that. And I've updated the Lyme-Ed program on like SOT, for example, which we're doing in our practice, and we are seeing good results with that. So there are some newer treatments emerging.
Maybe explain SOT for those that haven't maybe new to this.
Yeah, so SOT, they've now renamed it Q-Restrain, but we will still recognize it as SOT. Stands for supportive oligonucleotide therapy. And what it is in essence is it's a gene silencing therapy. So how it works is you get your blood drawn, the blood gets sent off to a lab in Greece called RGCC, and you have to pick a target pathogen. You have to have a test result for a certain target pathogen within 6 months of ordering the SOT. So the blood gets sent off to RGCC. They make a remedy based on the individual's blood sample, based on the target pathogen. So it will only work for them. It could be infused into somebody else, it would do nothing. And it gets sent back and it's infused, and it goes into the body and works to disrupt the DNA of the pathogen, of the bacteria. And so it's inhibiting the bacteria's ability to replicate. And so, it can be used in conjunction with antimicrobial therapy, whether that be herbs or antibiotics or whatever, or it can be used as a standalone. But it's traditionally was used for cancer treatment, and now in more recent years, it's been more utilized for tick-borne pathogens. So it's an interesting therapy, and it's a nice alternative to doing, lots and lots of antibiotics.
Awesome. So I'm sure that'll help people understand. Probably, I'm not sure how much of it's available in Australia, but the other thing
It
I
was at one point. I don't know if it
was it.
still is. It was
Okay.
at one point. RGCC does have a provider listing on their website, so you'd be able to search that up.
Awesome. Awesome. And so when you're talking about herbal antimicrobials and antibiotics, so obviously in Australia it's going to be quite different. And some of the interviews I've done in the lead up to this of late, they're really saying that herbal antimicrobials aren't a lesser approach necessarily, that they can be very powerful in moving people forward with these infections. What's your experience of that, Dr. Nicola?
Yeah, I mean, I think so too. I think they can be very powerful. One of the things I've always really stuck with very, very closely is like the recognition of co-infections. And I think that a lot of people I've seen that haven't progressed have just been treated for like one infection and not the other. And so obviously that has repercussions in antibiotic protocols, but in herbal protocols too.
Mm.
There are some herbs that have a greater affinity for Babesia and some that are stronger for Bartonella. And so I do think, and that is one thing that is available in Australia. And there
Yeah.
are some very good, I mean, like I said, I outlined some protocols in Lyme-Ed. I work with individuals to kind of like tailor protocols to them. And there are also some outline protocols like the Buna protocol, the Cowden protocol, that kind of do take it step by step and help people. They do provide a guide. I don't think it's a replacement for individualized care, but for people who can't access care, they do provide
Mm.
a guide of, how to comprehensively treat these tick-borne infections.
Yeah, there's a lot of Australians taking advantage of those. So, and I think, the more that we have step-by-step guides and people like you would know, Dr. Nicklin, nobody resonates with the same practitioner, right? So,
Right.
we
Yeah.
have, invitation to review and people can get to know you and your protocol and what's available for you. And I know that that will draw in the perfect match really in patient to practitioner. Is there anything I missed in asking about the protocol itself that you think would add value?
I mean, I would just, yeah, stress the things that stand out to me now in my practice are the role of mold, the importance of addressing that. Um, Also, just yeah, addressing terrain, like just your underlying health.
Yeah.
So a lot of that is trying to support immune function as much as possible. Diet and lifestyle, stress management, sleep. All of those fundamentals can go a long way. And then, yeah, and then I think the nervous system regulation piece is big. And then looking at supplementation, adrenal support, mitochondrial support, really big. And then layering on some herbal protocols. I think people could go a long way with all of that.
Absolutely. I think, I think, this may sound like a negative statement, but from where most people, like for me, sort of, because I've only had sporadic care here and there. And I got bit in 2002. It's a, it seems like a forever situation, right? The next thing's around. I got mast cell last year and, the next thing's around the corner. But I know that the other thing would be for me, and, anybody watching this, I want you to think about yourself. What if you could progress 50%? What if your quality of life went ahead 50 to 70%? I know at some points in my journey, I've been 80% of who I used to be. And that was something to celebrate. It was great. And I don't want to take away 100% from people here today, but I think, going forward 50 to 60 to 70%, it would be the people I see in my inbox right now. It's it brings me to tears on a regular basis. And I know that you can have with some of these pathways a great improvement and a great progress to quality of life. And I think that's yes, and I think new things will come in the future for us to get to 100%. But right now we're at, and we have to face it. And I think we have to push forward. And I'm so grateful that we have pathways like this and doctors like you, Dr. Nicola.
Mm.
So if someone is resonating with this and they want to explore Lyme-Ed as a next step for them, what are their options? What the steps do they take?
Yeah, well, I can put a link. I'll put a link in the
I'll put
chat
it,
to the website.
I
Where
can get that and put it up with the recording.
Okay, perfect.
Yeah.
So yeah, that would be the next step, just to go there. It is a self-guided program. And so you just enroll, and then some people work through, modules 1, 2, 3, 4, 5, 6, and some people jump around and just pick and choose what they're most interested in. But like I said, it is very comprehensive, and I do update it when there's new things to talk about, like the SOT.
Yeah.
There's definitely some learning in there about that. So
And
yeah.
would if they needed some help, do you have like coaches, or can they book an appointment with you, or if they wanted some guidance at any point?
Yeah, so if people need more individualized guidance, then they can book an appointment with me. I do Zoom telehealth visits, and so yeah, I've always done that with the Australian patients.
Awesome, awesome.
Yeah,
And what would you like to leave patients in Australia right now from your heart for the
yeah. I
current
just,
situation?
I think yeah, like I said, I'm sorry. This is hard, and it's not your fault. Um, and I would just encourage you to stay empowered as much as possible. Get whatever support system you can get around you. And, I know the Lyme Disease Association has offered great support and things for patients as well to come together, um, and a sense of solidarity. And just, you're not alone in this.
Mm.
But just do the little things. And Sharon, I 100% agree with you. Like, what if it was 10% improvement first? And then what if it was 10% after that? And then, what if all of a sudden you're at like 70% better, 80% better, and you're like, oh, how did I get here? Well, it was step by step, and it was the little
Yeah,
things that you do. And just try as much as possible to channel your energy into healing, and not in looking back, not looking what you've lost, not looking at what hope and help isn't there, but really look to what help is there, and how can you tap into those resources, and how can you
yeah,
tap into and the other thing I would say is, like, really focus on maintaining positive relationships. Like, I understand, I've been in the Lyme world for 23 years, so I understand how easy it is to just kind of bathe a little in the, oh no, this is so horrible.
yeah,
But if you catch yourself doing that over and over again, then maybe give yourself 10 minutes to feel that, and then decide, like, you know getting out of those negative thought loops is actually a decision. It's not something that's going to happen just on its own necessarily. It is a decision. So, if you need help, jumping into one of those programs like Primal Trust or something like that can give you tools. And yeah, so just the little things that you can do, the things with your diet, with your lifestyle, with stress management, with maintaining healthy relationships, with anything to help calm your nervous system, make your nervous system feel safe. And then nourishing your body with good foods, with good herbs. And just recognize that the infections themselves are only one part of chronic Lyme.
mm,
I mean, there's so many more pieces, and pieces that you can get help with in Australia. I mean, like I said, there's so many good naturopaths that know everything about adrenal support and thyroid health, and then I would say utilize Western medicine when you need it, whether that's for diagnostics, or if it's monitoring just one part, or if you just want to go get a cardiology workup because you're a bit nervous about your heart symptoms, or you need thyroid medication. Well, sometimes the allopathic docs can be fine for that one part. It's not the
mm.
way we would choose to do it. We'd like to have a whole body, whole person approach. But if it comes to that, then, use them for what you can get, and
Yeah,
just recognize and accept that they're not going to be able to offer the whole thing. But if you patchwork it with the right people, the right support, and the right information, then I think that there's still plenty that can be done.
Yeah, agree. Progress is available to you. Yeah.
Yeah.
So, Dr. Nicola,
And
thank you so.
celebrating the wins. That's what I would say.
Oh,
Celebrate the wins, you know.
yeah.
I have a mastering mindset group. It's a small group coaching program, and every week we start with, what's one win? And somebody might say, I had a shower today.
Mm,
It's like awesome, you know? Like
yeah,
really celebrating and if there is improvement, that incremental improvement, that 5%, it may not feel like enough, but 5% is great. And then you add another 5%, and then you add another 5%,
that's right.
and all of
Yeah.
a sudden you're on your way.
Yeah. And sometimes you can't feel those 5%. You look back and you go, oh, I can do this now.
That's right. Yeah.
Mm. No,
Yeah.
that's awesome. God bless you. And thank you so much for always being here for Australia. We really appreciate you, Dr. Nicola.
Oh, you're so welcome.